Hi, everybody. Welcome. This is Dr. Peter Bongiorno, and I am coming to you from New York. I'm putting on my video. This way I can say hi. All right. Welcome to my office. I am in Long Island, New York right now, and it's such a pleasure to be here and such a pleasure to be speaking to you all. All right, so happy Thursday. And usually when I start these presentations, I really miss everyone and seeing everyone in person. And so I do try to visualize myself at one of our lectures and get-togethers, and just seeing all the wonderful people in the room, and seeing all of you who I know well, and a lot of people who I don't know. And so for those of you who haven't seen me before, welcome. It's just great to have you here. So clarity with COMT, integrating mental health support and nutritional genomics. And just as a disclaimer, I am a paid medical advertiser for Douglas. No conflicts or otherwise to disclose. This isn't actually considered standard medical care, and these therapies are not substitutions for standard medical care. Practitioners are solely responsible for the care and treatment provided to their own patients. And these are the wonderful people who I work with in my office here at InnerSource Health in New York. We have an office both in Manhattan, where the surge is starting to happen again, unfortunately, and things are starting to close down. And where I am today, which is in Long Island, we're starting to see an increase in COVID patients. All right, so before we talk about COMT in particular, let's just talk a little bit about what's going on with mental health in the country. Up until COVID-19, prevalence rates for anxiety were probably running around 10 to 15%, depending on what statistic you were looking at. In terms of depression, probably around 7%, and then suicide rates maybe around 4 or 5%. And since COVID, so this is CDC, MMWR, morbidity and mortality reports. And they looked at basically people at about the same time of year, the late June in 2020 versus 2019. And what they found is indeed anxiety rates have skyrocketed since a year prior. We have 3 times the prevalence of anxiety, so probably around 25, 26%, 4 times the prevalence of depression. Now it's closer to 25%, and also double the rate of suicide, probably close to 11% now. And somewhere between 10 and 15% of US adults have started or increased substance abuse use over what they were already doing. So, and that's interesting, because if you look at statistics from the CDC, between the year 2000 and 2015 or so, you also see suicide rates skyrocketing in general, even though the rates of antidepressant and anti-anxiety subscriptions have gone up about 65 to 70% in that same time period. So that was all pre-COVID. We saw things just getting worse and worse and worse. And now we're just seeing an exponential increase in all of this. And we weren't, as a whole, the conventional medical system really wasn't doing a great job treating mental health. We were just medicating it more. And now it's really at the place where it can't handle what's happening. And so I do think what you do, what I do, is so needed even more, because we have so many more tools than just covering up symptoms. And so I'm really glad we're here, and I'm really glad we're talking about all this. So what's the role of neurotransmitters in mental health? So just as a general overview, neurotransmitters are endogenous chemicals that enable communication with the nervous system and between the nervous system and the rest of the body. So it's how our body talks to itself, right? It's how our body governs itself and communicates. It relays information between the individual neurons and ultimately regulates a wide variety of bodily functions. Because neurotransmitters can impact a specific area of the brain, they play a role in mood and mental health. So, and neurotransmitters from a conventional psychiatry standpoint is really the focus, right? So when someone has a mood disorder, usually medications are used to somehow alter either the breakdown or the uptake of these neurotransmitters. And in truth, when it comes to anxiety, it works pretty well. When it comes to things like depression, it's not so obvious. Probably around 30% of patients who use an antidepressant, particularly an SSRI, um, gain benefit, which means a good 7 out of 10 actually do not. And interestingly enough, there's another medication called a serotonin reuptake enhancer, and that actually has shown to have similar efficacy, even though it's the exact opposite mechanism. So it just tells you that neurotransmitters certainly play a role in mood and mental health, but are clearly not the only issue that we should be considering. And this is a representation of a patient that I see every day, that I'm sure you see every day, on a female, 43 years old, very high stressed, especially at work. She comes in because she just isn't feeling well. Maybe she feels foggy during the day. Maybe she's tired and wired. Her anxiety is getting to the point where she feels like she can't function the way she needs to anymore. She's tried, doing some yoga. She's tried a little bit of meditation. She's going to bed a little earlier, and it's not really helping the way it needs to. So what are the tools that we have to help this patient? What are the tools that we have to help Anna and the patients that you see? Well, and when I work with each patient, and this is what I talk about in all my books, is that it's very important to create a method that works for you. And this is the method that works for me. I do a very clear and complete intake. My intake is about an hour and a half, and I'll really sit down and get to know the patient during that first visit, and follow-up visits are an hour. And we talk about everything, right? We talk about, of course, their chief complaints. We talk about what's going on with their stress in their life, their lifestyle, their diet, how they're sleeping, what are they eating, of course. We talk a lot about schedule, because if you don't understand a patient's schedule, it's really hard to understand how to implement changes if realistically they can't get those changes in there. Um, and then I look at labs. I want to look at blood work, very extensive blood work, which obviously we would talk about it at a separate lecture, and I discuss in detail in my writing. Urine tests to look at hormones. Sometimes to look at toxicology and toxicity pictures. I like to look at GI testing to see what's going on with the microbiota. And I like to do genetics testing. So today, we're really focusing on one tool that we have, right? The genetics piece. And then based on all that information, then I make recommendations. We work on sleep and sleep rituals. We bring in exercise that's going to be appropriate for that particular patient. We talk about their thoughts and their passions, and what makes them happy, and what do they really want to be doing with their life. We try to get the patient into nature. We change the food so that they're eating foods that are balanced for them. Possibly detoxification, depending on what some of the testing says, we might want to do detoxification. And then picking the right nutrients based on the lab tests, based on the intake and what we believe might be deficient, or to balance certain things that might be in excess. Other modalities, I use acupuncture. I'm an acupuncturist. It might be Reiki, it might be cranial sacral therapy, chiropractic, going to see other specialists, just depending on the case. And then once the patient is in a good place and they're near 100% better, then if they're on the medication, then we discuss the idea of possibly weaning. And most of the patients I see, probably a good 70% of patients, when they come in, they are already on some kind of antidepressant or anti-anxiety medication, or something like risperidol for bipolar. And of course, the best thing to do is not start by weaning them off the medication, unless there's some clear need and urgent situation that they need to get off it. I'd rather do all these things first, take my time, really focus on the underlying cause, right? Because that's what that picture of the iceberg is about. The iceberg is suggesting to us that the symptoms a patient is having is really just the tip of the iceberg, and that And what we want to understand is what's going on underneath that tip of the iceberg, so that this way we can make the right changes and actually affect the symptoms and help people feel better, which is certainly something medications themselves don't do. Sometimes medications help a person get out of a tight spot, and I'm certainly not against them if that's what they need to do to kind of help rebalance so that we can work together. I had a patient today. I was speaking with actually her mom because um, the patient herself didn't want to come in. She was so anxious, and sometimes if we need to do a medication to just help that patient balance enough so that we can get them in the door, so we can start working on these things, then that's okay too. But the idea is not to just put somebody on a medication, get them feeling a little bit better, and then keeping them on the medication and not doing these other things. And I know I'm preaching to the choir here. So today we're going to focus on genetics, and we're not going to even focus on all all genetics, but we're going to focus on one. So I just want to put that in context, because when we work with the patient, there are so many factors involved why someone might have anxiety and someone might have depression. And it's really important to make sure that we look at these genetics in the context of, first of all the other genes, and then all the other issues going on and factors going on in a person's life. And that way we can really make the best decisions. Okay, so back to Anna. Anna's nutritional genomics results include some insightful information. So what we did was we had Anna run a 23andMe test, and we put it through Pure Genomics. If you haven't used Pure Genomics, it's a wonderful program. It's a program I trust. Dr. Kelly Heim, Dr. Nathan Morris had basically put this together, and it's really a program, in my opinion, that's very, very conservative, in the sense that it doesn't give you all the genes sometimes that other analysis might look at, but the data it does give you, you can really count on, because it's really well vetted, and it's very strong in that it doesn't look at data that it just has small amounts of information, but actually data that's that's reproducible and has been reproduced. So, for example, we looked at her COMT gene, right? Since that's what we're going to be talking about today, this methyltransferase, and what we found is that the patient's variant is an AA. And that is one of the risk variants. So, and we'll be talking about exactly what that means and how we can use that information to help Anna, right? So what is COMT? So COMT is a Catechol-O-methyltransferase. And it's basically a class of enzymes that catalyze the transfer of a methyl group to their substrate. So it helps break down molecules with catechol structures by adding methyl groups. So that's its job. Right. What does COMT metabolize? So it does a few things. It metabolizes catecholamines, so it breaks down dopamine, epinephrine, and norepinephrine, also known as adrenaline and noradrenaline. It breaks down catechol estrogens, so these are estrogen metabolites with catechol structures. It breaks down drugs with catechol structures, so an example would be glutamate blockers. And it also breaks down other catechol structures, things like green tea, black tea, certain foods, things we'll be talking about in a little bit. So today we're really going to focus on catecholamines and how it affects cognitive health and cognitive function. So we're going to look at COMT in reference to the breaking down of dopamine, epinephrine, and norepinephrine. So how does COMT work? Dopamine is an example substrate in this particular picture, and what happens is that the COMT enzyme binds, creates a conformational change that binds to the enzyme, which the substrate in this case, which is dopamine. It uses SAMe as a cofactor, which donates methyl groups, and it creates this methylation change, which usually inactivates the compound that it's methylating. So, so it's basically something that binds to the catecholamine and inactivates it. So I put together this diagram because I wanted to be a little more complete in terms of what it does. So again, for the example, dopamine comes from tyrosine. and it from dopamine gets broken down into norepinephrine through basically two pathways, right? One pathway goes through COMT and makes HVA, which is homovanillic acid, which gets brought out into the urine. And the other pathway gets moved through norepinephrine, then to epinephrine, and then also gets peed out into the urine as vanillomandelic acid. And the thing that I'm interested in here is that when we have this norepinephrine and epinephrine, when it's in normal amounts, we see it come into the urine in reasonable doses. And this is actually something you can measure in urine tests. When there's a lot of dopamine around, as an example, and a lot of norepinephrine and a lot of epinephrine, it actually moves into other compounds as well, methylamine, ammonias, and formaldehyde. And we also end up seeing a lot of inflammation in the brain as a result. And this can be an important reason why some people are more likely to have emotional and mood disturbances as a result. So the common variations in the COMT gene affect enzyme stability and function. So there's basically three ways we want to think about this COMT enzyme and how it's working. And the way I like to think about it is that there's a slow version, a medium version, and a fast version. And the slow version is not very good at breaking down these catecholamines. It doesn't do a great job. Basically, it doesn't have the conformational changes it needs because of these met changes in the as a polymorphism. So what happens is it doesn't bind as well to the catecholamine, doesn't break as many down, and you end up with a lot of more catecholamines around. Versus the GG, also known as Val-Val, which is what I consider the fast version, which breaks it down very quickly. And you don't have typically enough catecholamines around. And then there's a middle version, which is AG or METVAL, which breaks down certainly more than the fast version, but not as much. I'm sorry, certainly more than the slow version, but not as much as the fast version. And what's important is, years back when I first started looking at COMT and looking at the analysis, I remember they used to put they would have them described as red, yellow, or green when they talked about it. And red was the slow version, yellow was the heterozygous, one in the middle, and green was the fast version. And it kind of suggested that red wasn't good, right, because there were too many catecholamines around, and that the middle one was better than the red, but not as good as the green one, which was the fast version, which didn't have as many catecholamines around. And what I've learned is that that's kind of a mistake because there's no good or bad version of these genes. What we need to keep in mind is that these genes are they're associated with mood and cognitive function, but so are many other genes, and so are many other things we do for our bodies and for our life. So which gene we have and how it affects our cognition is really going to depend on a lot of other things, including whether we're getting enough sleep, what kind of exercise we're getting, how we're eating, nutrients we're taking, nutrients we're not getting in, and so on and so forth. So I just want you to keep in mind that any particular SNP doesn't necessarily suggest a better version for your patient or a not better version. It really depends on your patient. So if your patient comes in and they're complaining of some kind of digestive issue, and you run their genetics and you notice that they have the AA polymorphism, it doesn't necessarily mean that you need to treat it, because for them they might be a little bit more of a worrier, and they might be a little bit more of a type of person that stresses, but maybe that's what makes them great at their job. And maybe they don't have issues that are stopping them from doing what they need to do because of how they feel, but it's actually allowing them to do what they need to do and be effective at it. And they're really actually quite happy with their life, and they're otherwise quite balanced. So in that case, this quote worrier gene isn't something that needs to be fixed. But for example, with the patient Anna, who we saw earlier, She's very stressed at work. She's not getting her work done. She kind of obsesses over different things and can't figure out what to do and can't stay effective because she's just worried. She keeps getting recurrent thoughts about things. And she also has this AA, low enzyme activity, the slow version. And for her, that's something to be worked on, and that's something that does require balancing, and that's we'll talk about in a minute how to do that. So, but my point with the slide is just to help you remember that, but we have to really think about it in context. We can't think of these genes as a good to have or bad to have. We just think of them as what what the patient's tendency may be towards having mood that could either be more worrisome or or the GG version, the warrior. And I didn't talk about the warrior. The warrior has the fast COMT, so they break down catecholamines very quickly. So these are the people who can go into stressful situations and they burn through their stress hormones, so it doesn't affect their brain in a negative way to the point where they can't function. In fact, they're the ones who actually function best in that kind of situation. And when they're in balance, they can really be at their best when things are stressful. They actually do poorly when things are calm. They're the ones who maybe can't relax and can settle down because their catecholamines are low. These patients are always looking to kind of raise catecholamines. These are the people who are looking for adventure and looking to bungee cord out of off a cliff or something like that. But you will see when you look at these GG high enzyme activity patients that it's something to think about, because I think you'll see a lot of correlation. Anyway, so the AA, the MET, this is considered the slow enzyme activity. It clears catecholamines very slowly. So you end up with more elevated catecholamines in the prefrontal cortex, right? The prefrontal cortex, where we're doing all of our thinking, right? So it helps us obsess, it helps us worry, it helps us fixate on things. And these people, when they're balance, they actually tend to have very good executive function. These are usually quite smart, intelligent people, and they can be effective and they can get things done. But like I said, they struggle in stressful situations. They're the worriers. They're the ones who sometimes take a situation, obsess about it too much to the point where they start becoming ineffective. So how do you address that slow COMT phenotype? Diet is certainly one way. Cruciferous vegetables. And the reason for the vegetables is, and I didn't mention this, but when you have the slow COMT, which not only you're not breaking down catecholamines, you're also not breaking down estrogen. So these patients are also going to be more likely to have high estrogen. And what does estrogen do in the brain? Estrogen also supports serotonin levels as well. So you're going to, and it also inhibits COMT effectiveness. So it kind of creates this loop where COMT doesn't work so well. It raises estrogens, and estrogens even inhibit COMT even more, which raises estrogens and affects serotonin by really creating this imbalance with the other catecholamines. So cruciferous vegetables can be very useful for that. Broccoli, Brussels sprouts, arugula, kale, cauliflower, flaxseed and soy, similarly. And then from a calming standpoint, for the catecholamines, Avena sativa, putting patients on a lower protein diet, more of typically a vegan program. And the reason for that is because using the, amino acids are precursors to these catecholamines. And when patients are taking in more of things like tyrosine, as an example, they're going to be making more of these catecholamines. So, so limiting it can be very useful. Although I still recommend that you create a diet that's balanced, and we want to focus on antioxidants. And the reason for that is because when dopamine breaks down to norepinephrine and epinephrine, we're going to have a lot more inflammation in the brain, and we're going to need those antioxidants around to protect the brain. And also we want to avoid alcohol. Alcohol itself also inhibits something called cytosolic sulfur transferases. And these sulfur transferases themselves are needed to break down catecholamines too. So, so when we drink alcohol, also coffee can do it, certain berries, cheeses, things with catechol structures will also increase the imbalance that's already going on. Okay, so how to address the slow COMT phenotype? We want to think about lifestyle too. Um, for people who have trouble getting things done under pressure and they need a calm environment, we want to supply that to them. And I know the world can't be calm all the time, but we want to bring calm when we can, right? If they're trying to meet a deadline, talk to them about ways to create an environment for them that's less stressful. While they're doing their work, maybe they could be in a calmer situation. Try relaxation techniques, therapy, meditation, and these are the people who are going to sit down with you, and it'll be hard at first, but they'll get fantastic benefits from it. So it's worth working on. It's worth teaching them how to breathe from their belly, how to cope with stress, because they have these high catecholamines, and giving them these tools will help them naturally lower their catecholamines. And then as far as supplement considerations, what are the things we like to think about for them? Lithium orotate. Lithium orotate is a wonderful mineral that helps calm the amygdala. It helps raise oxytocin. It benefits brain-derived neurotrophic factor as well. So there's a lot of places where it helps bring balance for people who have the slow COMT and they have these higher levels of catecholamines. Magnesium glycinate. Magnesium, of course, is very calming, and glycine is a very calming version of magnesium. Adenylyl and hydroxy B12 can be really useful too. The reason why, and we'll talk about this in a bit, is we don't always want to use all the methylated forms of B12. And then SAMe, because it's a gentle but effective way to bring methylation to patients. So SAMe, if we look at the methionine cycle, right, does support methylation of DNA. It supports methylation of these methyltransferases like COMT, and actually about 70% of SAMe's methyl groups go to creatine. So it also supports muscle, right, as well, and energy. And then Pure Genomics has an ultra multivitamin, which includes vitamin C, which is really important because when a patient's really stressed out, those adrenal glands really need support, and vitamin C is, out of all the places in the body, vitamin C is most concentrated in the adrenal glands. So we talked about slow COMT. Now we're going to talk about fast COMT, right? So fast COMT is a higher enzyme activity, which means that it's going to be breaking down catecholamines at a much higher rate. And for many patients who you see who have mood disturbances, it's doing it probably too quickly. And they're the ones who are going to have lower catechols in the prefrontal cortex. And so what's the effect for these people? They have sharper executive function in stressful situations. So they're the ones who run a very stressful business, and every day there's fires to be put out, and they're making fast decisions saying, okay, you get this one done, I'm going to take care of this, that gets done by that person, don't worry about that. And they hit something and they move on, and they go to the next thing and they move on, and they're good at doing that. Because remember, the slow COMT people generally will obsess over each one of them, and their brain will be trying to handle them all at the same time. The fast COMT people are usually better at kind of moving on from one thing to the other, but they also struggle more in normal and non-stressful environments. They're the ones who can't calm down. You ask them to meditate, and they'll lose their mind. They're not going to do it. Right, and they benefit from movement and dynamic environments and that sort of thing. These are the patients who in more normal environments are going to have more focus issues. They're the ones who don't do well and can't really focus unless things are crazy, right? Because then their catecholamines go up and they feel more imbalanced. So how can we help those patients to address the fast COMT phenotype? First is diet. So we kind of want to do the opposite of what we would do for the slow COMT patients. Give them things with catechols, berries, bananas, citrus. It's interesting. In the 90s, I had done some work the NIH, and we were doing these overnight pulsatile studies of hormones, and it was my job as a research assistant to take little bits of blood from veterans every 10 minutes, just a very small amount, and spin it down, and I would have to stay up overnight. Really, it was 24 hours straight I was doing this. And I found in the middle of the night, when I ate citrus, I would eat a couple of oranges, and I found that it kind of kept me awake. And I thought it was just the sugar and the water. But now that I've learned about this, what I've learned is that citrus actually is kind of it has a little bit of a stimulating effect. So it kind of brings up your catecholamines maybe at a time in night when they want to be at their lowest. So that's probably why I was gravitating towards them. Cacao, right? Chocolate can do that. Coffee certainly does that. Coffee is helps COMT move forward. Green tea, black tea are also sources of catechols, and adding more protein to the diet. So in this case, you want those tyrosine precursors and tyrosine as dopamine precursor. So what about lifestyle? What do we want to do there? Well, like I said, these are the people that thrive in dynamic environments and they function better under pressure, but they don't really focus as well unless they have a pressure deadline. So for these people, we want to have them eat the protein. We want them to exercise because movement and exercise will help naturally raise things like dopamine and norepinephrine. I mean, think about what they use for people for focus, right? They use drugs that raise dopamine and raise norepinephrine. Exercise is probably the best way to do that. So these are patients who absolutely need to exercise regularly and exercise vigorously, as long as they can handle that and they're not deficient in other ways. Whereas the people who are the slow COMT, they probably do better with yoga, meditation, gentle movement, maybe Tai Chi, Qigong, things like that, things that are much more calming. So what are the supplement considerations for those with the fast COMT? Pure has a great product called Dopa Plus, which has tyrosine, which is a great dopamine precursor. It also has mucuna, which is an Ayurvedic herb, which helps support dopamine production. Rhodiola, which is a good COMT inhibitor, so it kind of will help slow it down a little bit, like the coffee. SAMe, again, because it does support neurotransmitter production as well. So, and I'm going to talk about that balance in a second. So just hold on to that thought, because I know we talked about SAMe for slow COMT. Now we're recommending it for fast. So how can that be? So 5-HTP, which also supports serotonin for the reasons we talked about, because of the way estrogen, low levels of estrogen are going to also lower serotonin as well. And then for patients who have certain MAO SNPs, you'll see that even more pronounced. And then neurotransmitter balance, it's actually, as a disclaimer, is a formula I formulated, and it has tyrosine in it, it has mucuna in it, it has 5-HTP, it has SAMe, and it has a Chinese herb called apocyanum, which I like because it actually supports the GABA system a little bit. So while you're raising the catecholamines and the neurotransmitters, you're also bringing some calm to the situation at the same time. So for a lot of these patients, especially with the low mood, low cognition, and we want them to focus a little bit, I found that to be a very, very useful combination. Okay, so I alluded to this before, and I wanted to just talk about it briefly. Overmethylation versus undermethylation, and how does that affect what we're going to give a patient for slow COMT? So it says here, slow COMT has excess dopamine in their prefrontal cortex. Right? We can speculate that providing additional methylation through supplementation may not be tolerated well, as more methylation may cause an increase in neurotransmitter production. So the reason why is because for those of you who know about MTHFR and the folate pathway, the folate pathway is hooked up to the methionine pathway, right? And the methionine pathway is where SAMe is generated to make those methylation factors, right? And when that's working well and homocysteine is moving through to the transsulfuration pathway, the folate pathway should be working well. And then that supports, on the other side, the biopterin pathway. And the biopterin pathway takes in amino acids, things like tyrosine, to help tryptophan to convert to the neurotransmitters, right? So we're in this situation where good methylation, like if the MTHFR is working properly and MTRR that supports B12 is working properly, then we're in a situation where we might get into trouble with the methyl groups, where supporting methylation might actually provide a ways to make more neurotransmitters and more catecholamines instead of supporting COMT as a methyl transferase to break down the catecholamines. And I apologize because I know I'm kind of talking back and forth here, but these are the things that we have to think about. So in general, if you want to start to support methylation in slow COMT patients, you need to go very, very slowly. And I generally don't recommend methylfolate as a way to start that. I usually recommend the other methyl groups. Like here we have a homocysteine plus TMG that has trimethylglycine in it, that has riboflavin, that has vitamin B6, and even using things like adenosyl cobalamin instead of methylcobalamin for the same reason, because we don't want to overdo supporting the BH4 biopterin pathway through methylation, because typically that will unbalance the methylators. And what I've seen in my practice is that starting even with a little bit of SAMe is typically a little bit safer. And if you do use it and you find that patients are starting to get irritable, they're starting to get angry, they're starting to get wired, and you run some tests and you see their homocysteine going up, then you know that the folate methionine pathway has to be adjusted first before you can start using more methyl groups. So it's just something to think about. I know there's a lot of players here, and we kind of want to think more globally before we start using especially higher doses of these methyl groups. So, and another additional topic to consider is drug interactions. When we think about the worrier, the slow form of the COMT, slow COMT has more neurotransmitters in the synapse due to lower enzyme activity, and individuals with this genotype may be more sensitive to the effect of stimulant medications. So, so when patients are when they already have a lot of catecholamines around and you give them more stimulants, you might see them take off. And you've probably seen this with some of the kids in your office who are on certain type of stimulant medications, and and the parents say, gosh, they took it and boy, they got worse. They're probably the slow version of COMT, because whereas the fast version of COMT probably would do well with that because it raises it for them because it was already low. So in summary, nutritional genomics can unlock an important piece of patient wellness for those seeking mood support. COMT regulates enzymatic activity in the brain, thereby playing a key role in mood regulation. And we have really the three versions, right? We have the slow version, the one in the middle, and the fast version. And which version is going to work for your particular, which one is best for your particular patient really depends on their presentation, and it may depend on some of the other genetic SNPs from other genes that they have. And so you just want to use your acumen and really just kind of look at everything you can possibly look at, and be methodical, add one change at a time, see how they adjust to it, think about the genes they have, and then it starts to make sense, and then it really becomes, as a clinician, it becomes really exciting because now you see how things sort of fit in with each other. And I do certainly encourage you to use Pure Genomics. I think it's an excellent tool. It's very trustworthy. It's easy to use, it's reliable, and as the data comes out, those guys are adding more and more to it. It's my go-to. Have my patients run 23andMe. I put it through Pure Genomics, and then I give the patient the report, and there's suggestions for you for supplements if that's something that you want. But certainly the data and the information itself is, to me, the most valuable piece of it, because it allows you to really take a good look at it and get a good picture of what's going on. So I highly recommend you try it. Feel free to give me a call or an email. I'd be happy to work with you on that. My email is drpeter@innersourcehealth.com. That's drpeter@innersourcehealth.com. I have a newsletter. Happy to send you, updates and research as it comes out. And please do connect with me. I'm really happy to talk shop anytime. And if we have any time left over, I'm happy to take a few questions.